Welcome back. We're sharing more of the concerns coming out of COVID-19 as health officials wrestle the numbers, urging residents to adhere to social distancing. Julian Reed spoke with infectious diseases consultant at the Princess Margaret Hospital, Dr. Nakia Forbes, on treatment regarding COVID-19 and other issues surfacing.
We are continuing to make available health facilities in order to meet what we expect to be a surge. We are not at our current capacity. We will know that we're at our capacity when the number of cases have exceeded what we can do in terms of offering care. We're making available some 80 plus to 100 beds that the minister has spoken about previously. And we are actively continuing our work to meet the demands of patients presenting to us for care. We are increasing the testing capacity also. You have heard that there are rapid tests that are being validated in country right now. Those are blood tests that can tell if someone has COVID-19 in the recent period. Within about 5 days, that is an acute infection, and longer. And so we're needing to validate those tests in country. At this time, the gold standard test is the PCR test that's being done at the National Reference Lab.
The rapid test. How quickly would you get the results from that?
They're still being validated, so that information we are needing to see what would happen when those tests are available in real time.
Now we're hearing a lot about different treatments that are happening around the world. Plasma treatments, an HIV drug treatment, and of course you are the director of the National HIV/AIDS Program, and I'm sure you must find that very interesting. Anti-malarials. And then antibody testing. Are we anywhere near to doing testing like that? Is it something that you see us doing in the future?
Let me start with the last part of your question. That's the antibody tests?
Yes.
That's exactly what's being tested for in the rapid tests.
Okay.
Usually those tests are available in a short period of time, hours, for example. So as it relates to treatments for COVID-19, in that this is a new virus, there is no approved treatment that is guaranteed to work in terms of the best quality evidence that scientists look at. We look at a large number of patients that are tested. We look at if they work, regardless of whether the doctor knows what the treatment is and the patient knows what the treatment is. And we look at large numbers and say that it absolutely works without a doubt, not by chance. No such evidence exists at this time. The position of both the Centers for Disease Control, U.S. experts, the World Health Organization, is that there is no proven treatment at this time, and the treatment is supportive, meaning that we will give antipyretics, we give other medicines to reduce symptoms, we can support respiratory distress or persons who are having difficulty breathing, we can support that. There are investigational treatments. You have mentioned some of these. This includes HIV drugs. It includes drugs that are in clinical trials now, a drug called remdesivir through Gilead Sciences. It includes interferon. It includes chloroquine, which is an anti-malarial drug. It includes hydroxychloroquine, which is used in rheumatoid arthritis and other conditions. Those have been put forward to be used, including plasma exchange from people who, plasma therapy from people who have had COVID-19 and survived. All of those have been put forward, and in some small groups of patients, they've been used. For example, the plasma was used in 5 patients under specific conditions. However, when we look at the information coming back from these studies, they're not robust studies. Just this morning, someone talked about the drug called hydroxychloroquine. And when you look at that paper, so scientists, what we do is we look at papers and we say, okay, was this valid or was it confounded by other factors? It was actually not a good quality study because the other patients who quote unquote did not do well on the drug were not actually tested afterward to see whether or not they would have cleared COVID-19, like the persons that were tutored to have gotten better. So we have to be very, very careful when we consider what are we saying as experts in terms of how COVID-19 can be treated. There are other factors. There are other factors that go beyond science. Sometimes people feel comfortable. There are other motivating factors for why someone could say that this treatment could be effective. We have to be careful because usually for disease conditions, for treatments to be approved, they have to work without a doubt. And there's a process to that. When we skip that process, we know that bad things can happen. Theoretically, some medications may work, but they may not work that way when given to persons with a condition. Sometimes they cause harm. In other viral infections, there were medications that were theoretically supposed to work, but they actually made persons worse.